Hey everyone, Jamie here. If this is your first time tuning in, this is my video diary of both my thoracic spinal fusion surgery as well as my cervical spinal fusion. If you have been tuning in, then tonight you will hear a little bit more update of where I'm at with my recovery and just sort of, seeing how things are. So, just as a recap, my thoracic surgery was back in January of 2019. I had a 7-level fusion, T5 through T12. And then back in September of 2019, I had a 3-level cervical fusion in my neck. So it was a C3 through C6. Say that 10 times fast. It was quite a year. In between, I also had hand surgery. I had done something to my finger, but that was like super minor compared to everything else. And if you've watched my other videos, you probably would have seen that I had a shaved head at the time, and now my hair is growing back. It's all kind of funky. It's blonde. I hope you like it. I kind of like it. They say blondes have more fun, but we shall see about that. So I'll give you the update on the cervical fusion first. That actually went really well. It was very successful. I can tell you it was much easier than the thoracic fusion. They went in through the front. You can see my scar here is still healing. It's still kind of pink. It's still sensitive. The skin around it, especially right up in here, is still pretty numb. And also this area here is also very, very, very sensitive. I did not have the normal lordotic curve that a neck normally has. So when they did the fusion, the surgeon created the lordotic curve, so it kind of pushed everything forward a little bit. And so it's been really interesting getting used to having my neck in a different position. So even when I touch my neck, it's like, oh, it sort of feels like I'm choking. But apparently that is a normal sensation. So if you are having or have had a cervical fusion, you may actually just feel that when you touch this area. Also, swallowing can be a little challenging. I have this habit now of inhaling my own saliva, which is really super fun. But hopefully that will all disappear at some point. I did have my x-ray. Everything looks great. Everything is healed. The bones are fused. However, they did say that there is still some swelling in the neck, which is normal. But otherwise, with PT and just rest, and, just trying to live my life as normally as possible, things have gotten a lot better. I pretty much have, great movement back, left to right, even back and forth. Although going forward does definitely feel a little strange, and I do get a little bit of a cough every once in a while. But otherwise, it's, it feels pretty good. And to be honest, right after the surgery, I did not feel my fusion at all. I think it's because it's interior, but honestly, if someone had told me that, 4 of the vertebrae had been fused together, I probably would have laughed because it really didn't feel like anything. So it was a relatively easy recovery. I would say the most challenging part is, wearing the neck brace and then going to the soft brace and sleeping. Sleeping now even is a little challenging depending on what position I'm in. So normally I sleep on my side, so if my head is in a weird sort of position, I do have to position it. Hopefully at some point that will go away. But, I'm just trying to be careful and be mindful of how I'm feeling and making myself as comfortable as possible. In terms of the thoracic surgery, that was also a success. Everything is fused at this point. Again, that was 8 vertebrae that they fused, T5 through T12. It's a pretty interesting area to have fused together. It's not typical, especially when you are younger and you don't have any trauma to the spine. Mine was all disc degeneration, which was compressing the spinal cord and also causing nerve compression and lots of other super fun stuff. But had I not had the surgery, I would either be paralyzed or maybe not even here because of the pain. I mean, it was excruciating. But anyway, um, I do still feel pain, but it is not nerve pain anymore. It is all musculoskeletal, which is to be expected. Your ribs go into the thoracic spine, and when the spine doesn't move but the ribs do, it can cause, some muscular pain and discomfort. So I'd rather have that than the nerve pain I was having prior. So the spine still gets stiff. If I'm not active enough, it feels like I do have a little bit of a Cadillac parked in my spine. But, it's just something that I deal with. If I'm having a bad day, ibuprofen always helps. It helps with any type of of inflammation. I also try to eat, anti-inflammatory foods if possible. But otherwise, I've been finding that doing stretches, especially through the intercostals, which are the muscles in between the ribs. So if I do, if I can stretch, one way, and then the other, I do find that helps. Child's pose and yoga. Is also great. I have been doing a little bit of yoga. I do modify since my practice is no longer the same. I've also been doing some sort of light cardio, which also helps with the body, with movement, with loosening up the muscles, as well as strengthening at the same time, which really helps the spine. And especially the lumbar spine, which is now taking a lot of the brunt of compression, since the thoracic no longer has the cushions in between it. So I try to take care of my lumbar spine as much as possible, which is important because that part is like one of the only normal parts of my spine that's left. So I have to say that between both surgeries, which were absolutely necessary, I am extremely glad that I had them done. And I am, getting used to my new normal. It's sort of, no one knows how long it's going to take. It could take years. But, I'm just trying to work through it. I'm taking everything day by day, which I think is the most important thing. I'm trying not to have expectations. I have taken yoga classes. And when I see everyone being able to do a pose that I used to be able to do and can no longer do, I've gotten upset and I've cried but then I remind myself that, this is my body and I have to be kind to it and I have to be mindful of what it can and cannot do. And it may not do what everyone else is doing, but that's fine. I think that's sort of how life is in general. So don't compare yourself to anyone else. Just see how you're feeling, how you're doing, and be mindful of pain, because you don't want to be in any more pain than you have been in or are currently in. So my suggestion is just take it easy. If you have not had surgery or you have and you're feeling somewhat doubtful or you're not quite sure, I can tell you that, I got with a great surgeon. He did an amazing job. Coming out of something as serious as spinal surgery is doable. Find support, whether it's friends, family, coworkers, or even a support group. Please, find that support. It's really helpful. Don't let anyone tell you how you're feeling. Okay, that's again also really important, because some people have ideas about spine surgery, and they try to push it on you, and that's not fair because they're not in your body. They don't know how you feel. If you want to get a second opinion, get a second opinion. All I can really say though is that if spinal surgery is necessary, get with a really good spine surgeon. Don't just go to anybody. There are surgeons in different parts of the country that specialize in fusions and other types of spinal surgeries, and you don't want just any doctor doing these because it is very serious. In my thoracic spine, I've got 2 rods and 14 screws, and in my neck, I've got 8 screws and a nice long plate. So you don't really want anyone messing around in there. Anyway, if you have any comments that you want to leave, questions that you might have, please feel free. I'm going to try to be a little bit better at checking in. I know it's been a while. Life has been a little crazy. But I just all hope, I hope that all of you are doing well. And if you are in pain or have questions or whatever, just, go ask, go talk to someone. Don't suffer in this, by yourself. I know it can be difficult, but it's important to get the resources that you need and to get the help that you need, because this is your spine that we're talking about. But anyway, I wish you all well. I hope that you all have a great weekend, and that if you are going through something, that it gets better. All right. So have a great night, and I'll see you guys soon. Bye.